Superior vena cava syndrome happens when blood flow through the superior vena cava is obstructed, either from within due to a blood clot or from external compression. Now, the superior vena cava is a short and wide vein on the right side of the chest that drains blood from the head, the upper body, and both arms, and then delivers all that blood to the right atrium of the heart. The superior vena cava can be obstructed in a few different ways, and the most common way is via a nearby tumor, through mass effect, which is where inflammation and swelling pushes up against other structures, in this case the superior vena cava. Alternatively, though, there can be direct tumor invasion into the superior vena cava, which is when tumor cells penetrate and grow directly into the tissue. This is only possible, though, if the tumor is located on the right side, near the superior vena cava. The most common type of cancer that does this is a lung cancer, and when it's associated with the apex of the right lung near the superior vena cava, it's given the name Pancoast tumor, after Dr. Henry Pancoast, who first described them. Also in that area, though, you've got a bunch of lymph nodes. And another possible cause of superior vena cava syndrome is a tumor of the lymph nodes, which again could lead to compression of the superior vena cava. Now, these could be lymphomas, which are primary cancers of the lymph nodes, but they could also be secondary, meaning they would have been spread to the lymph nodes from somewhere else, like the lungs. Apart from tumors, the superior vena cava can also get obstructed if a blood clot or thrombosis forms within it. This most often develops in people who have long-term devices like an indwelling central venous catheter. Regardless of the cause, when the superior vena cava gets obstructed, behind that obstruction you'll get an increase in venous pressure. When this happens, blood starts to get rerouted through different blood vessels, essentially draining into the inferior vena cava, which also drains into the right atrium. These vessels are now called collateral blood vessels, and are essentially alternate routes. If the blockage is low enough, these vessels could form in the azygous system, but also other options are the internal mammary, lateral thoracic, and esophageal venous systems. Over the course of a few weeks, these collateral veins dilate, after which point the venous pressure decreases a little bit, but it still stays higher than normal, even after the collaterals have fully dilated. Symptoms of superior vena cava syndrome relate to the blockage in venous blood flow. When there's a decrease in venous return, meaning less blood gets back to the heart, then that means that less blood's getting pumped to the lungs, and this leaves individuals feeling short of breath. Meanwhile, the backup of venous blood and venous stasis gives individuals a flushed appearance, as well as a swollen neck and chest veins. It also causes edema, where fluid leaks out of the blood vessels and into the surrounding tissues, resulting in swelling of the face, neck, and arms. Sometimes the fluid buildup can cause compression of the trachea and other structures in the upper airway. This can also cause shortness of breath as well as stridor, which is a harsh, high-pitched noise heard during inhalation. Excess fluid can also compress the muscles of the voice box, or larynx, which causes a hoarse voice. Fluid around the esophagus can cause dysphagia, which is difficulty swallowing. Most serious of all, though, is cerebral edema, which is where that excess fluid builds up in the brain. And this can cause symptoms like headaches and confusion. But worse yet, if the cerebral edema is severe, the fluid in the tissues can compress the tiny blood vessels supplying the brain with blood, and this can lead to cerebral ischemia. If superior vena cava syndrome is suspected, diagnosis can be done by chest X-ray or CT scan, which can be helpful to look for tumors and visualize collateral vessels. This is often done with a radio-opaque dye which is injected into the bloodstream, which can really help show where blood's flowing. For treatment, one general key intervention is making sure that a person's head is kept above the level of their heart. And this is because gravity can help drain fluid from the head and neck back towards the heart. Other treatments are dependent on the underlying cause. For example, a tumor is typically evaluated with a biopsy to determine its type and how far it might have spread, and it might be treated with radiation and chemotherapy. In addition, sometimes steroids can be used to reduce swelling around the tumor. If the cause is a blood clot inside the superior vena cava, anticoagulants can be used to prevent it from getting any bigger. Alright, as a quick recap, superior vena cava syndrome happens when blood flow in the superior vena cava is obstructed, most commonly from a tumor, which causes external compression, but it can also be from thrombosis. This obstruction increases venous pressure, as well as leads to edema, which can lead to a range of symptoms like stridor, voice changes, dysphagia, and even cerebral ischemia.